Welcome to our session on infection control and standard precautions. We'll explore strategies to stop the spread of infections in home care settings. Infections can spread rapidly in home settings without proper precautions. This training enhances your skills in hand hygiene, personal protective equipment use, and standard precautions to safeguard clients, families, caregivers, and the community. Protecting everyone is our priority. By the end of this training, you'll define infection control and standard precautions, identify the chain of infection, and demonstrate proper hand hygiene. You'll also learn to use personal protective equipment correctly, prevent infections across all ages, follow Occupational Safety and Health Administration bloodborne pathogen rules, and report exposures and infection concerns. Welcome to the core training modules. Apply standard precautions universally, treating all bodily fluids as potentially infectious. This includes blood, urine, stool, saliva, vomit, drainage, mucous membranes, and non-intact skin. These measures ensure safety and prevent the spread of infections. To prevent infection, we must break the chain of infection. This chain consists of 6 links: infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. Disrupting any link effectively stops the spread of infection. Hand hygiene is the top infection control measure. Perform it before and after client contact, food preparation, diaper changes, toileting, and after removing gloves or contact with body fluids. Follow these steps. Wet hands, apply soap, scrub for 20 seconds, clean between fingers and nails, then rinse and dry with a clean towel. Personal protective equipment, or PPE, is crucial for infection control. Examples include gloves, masks, face shields, eye protection, and gowns. Wear gloves when handling blood, changing diapers, assisting with toileting, performing personal care, and cleaning fluid spills to ensure safety and hygiene. To protect clients of all ages, wash hands and clean feeding supplies for newborns. Encourage hand washing and clean toys for children. For adults, monitor wounds and chronic illnesses and report any fever or drainage. Bloodborne pathogens like hepatitis B, hepatitis C, and human immunodeficiency virus spread through blood, needle sticks, and fluids. If exposed, wash the area immediately. Notify your supervisor, follow agency procedures, complete documentation, and seek medical evaluation if directed. Promptly report signs of infection, such as fever, chills, persistent cough, difficulty breathing, redness, swelling, drainage, vomiting, diarrhea, behavior changes in children, and condition changes in adults. Early detection is crucial for effective management. Hand hygiene is crucial. It's simple, quick, and the most effective method to prevent infections and save lives. Prioritize regular hand washing to protect yourself and others. Welcome to the section on case scenarios. In this scenario, before feeding a newborn, the bottle nipple falls on the floor. The correct action is to clean or replace the nipple according to agency and caregiver instructions to ensure infection control and the baby's safety. When a 4-year-old sneezes into their hands and touches toys, prompt them to wash their hands. Ensure all contaminated toys and surfaces are thoroughly cleaned to maintain infection control standards. When a client's wound dressing is saturated with drainage, observe the situation carefully. Use appropriate personal protective equipment, adhere to agency policy, and report the finding promptly. Remember, do not attempt to diagnose the issue. In summary, always use standard precautions and practice proper hand hygiene. Use personal protective equipment correctly to prevent infection spread across all ages. Follow American Healthcare Association and Occupational Safety and Health Administration requirements, and promptly report any signs of infection. Remember, observe, document, and report. Clean hands ensure safe care and healthy clients. Complete your post-test to earn your certificate of completion.